So hello and thank you everyone for joining us for today's webinar. We are here to talk about the Delta Leadership Institute and maybe hear a little bit about DRA. This event today is being recorded. The link to where the recording will be posted will be sent in an email following the completion of today's webinar. I am Caleb Lozinski, Outreach Coordinator with the National Rural Health Resource Center, who is providing this webinar today. Your audio is muted by default to avoid background noise and feedback. Please remain muted unless you have a question. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you dialed in, please press *6 to unmute your line. You can also communicate through the chat box, which is located in the bottom ribbon in the middle of your screen. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. The Delta Region Community Health Systems Development Program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. The center is committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is valued. You may learn more about our commitment on our website. And today, our wonderful speaker is C. Talantes. C. Talantes serves as Director of Human Infrastructure at the Delta Regional Authority, where she oversees the Delta Leadership Institute, DRA's Executive Academy, workforce grant programs, and health initiatives. With over 11 years of dedicated service to DRA, C embodies a profound commitment to Delta region's economic vitality and enhancement of its residents' quality of life. C, thank you so much for being with us today.
Thank you so much for having me. And it is a pleasure to be here. We love our partnership with the National Rural Health Resource Center, and Christina Wooden, our DRA's program manager over all the health programs, does such a wonderful job for DRA, and we're so lucky to have her and lucky to have this partnership. So we'll just go ahead and get started. Just a little bit about DRA first. Next slide. So, DRA was established and created in 2000 by Congress. And, really, the main goal of DRA is very simple. We're aiming to improve the lives of the people that live in our 8-state region. Next slide. And we are led by a presidential appointee, Dr. Corey Wiggins. He is our federal co-chair, originally from a small town south of Jackson, Mississippi, Hazelhurst, Mississippi. But Dr. Wiggins is, laser focused on DRA's mission. And then he's been doing a wonderful job ever since his appointment, oh goodness, a little over 2 years ago. Next slide. So, DRA is governed by the Board of Governors of our 8 states: Alabama, Arkansas, Illinois, Kentucky, Louisiana, Mississippi, Missouri, and Tennessee. Next slide. And I believe there they are, the governors of our 8 states. With this year's 2024 state's co-chair is Governor Andy Beshear. Next slide. And then I love this map. It's a nice visual of our region. Southern Illinois all the way down to the southernmost tip of Louisiana, and of course the 20 counties in Alabama's Black Belt, named for the fertile, rich soil in that region of Alabama. Next slide. And so now, let's talk about the Delta Leadership Institute, one of my very favorite things to talk about. Prior to DRA, I worked at the University of Alabama for 10 years and helped administer DLI, through our partnership with DRA and the University of Alabama. And then in 2020, came to work directly for DRA as DLI's program manager. And then a couple years ago, got promoted to Director of Human Infrastructure, but I still oversee DLI, which I think is one of DRA's most important programs. It really helps extend our reach, and I'm hoping to inspire some of y'all to hopefully apply to the next year's class. Next slide. So, just a little bit about DLI, and this picture is taken of last year's graduates, but we are in our 20th year of DLI. So not only, is it one of DRA's flagship programs, but it's one of our most long-standing programs. And really the goal is to inspire leaders, community leaders from up and down DRA's footprint to take what they learn from DLI back to their communities to make them a better place to live, work, and raise families. Next slide. And so how do we do that? And these are pictures, actual pictures of the DLI experience. So first of all, we give, through the programming and through the classroom time, the DLI fellows tools. We expose them to programming that again, they can take back to implement in their communities. We have executive education workshops. We do, this year, we've got diversity, equity, and inclusion and belonging workshops as a part of every session. We, go on, well, then the next one, field experiences. There we are doing a zip line in Louisiana is that middle picture. And that was a super fun experience, learning about the outdoor economy while we were there, having fun, but also learning. So, as y'all know, with adults, you can't just sit in a classroom the whole time and expect to keep everybody's attention. So with DLI, we get out and we see and we do. We really try to get to know the communities where we have our sessions. And so, okay, so tools, experience, and then to some people, the most important aspect of DLI are the networks and, connecting with their, fellow classmates, connecting with all of the different individuals that they meet when we're out seeing and doing as part of our field experiences. Also connecting to graduates of the program. We're almost 700 strong in the Delta Leadership Network, graduates of DLI and our alumni. So, once you graduate the Institute, then you become part of this larger network. And it's just a wonderful thing to be able to. Actually, I look at my DLI yearbook almost daily, and just to, sometimes I'm looking for, somebody in Missouri that has a specialty in X, Y, or Z, and being connected to that network is really beneficial to the fellows. Next slide. And so this is an example of, this year's actual schedule, and every year is different. And that's one of the things that we really love about DLI, and our planning team, is our ability to, to continually evolve and grow the program, to take what we've learned from each class to make DLI better. But this year, session 1 was part of the summit that we held in New Orleans. So, and that was the first time we'd ever tried that, but they went to New Orleans, participated in a morning of orientation, learning about expectations, getting to know the university partners that help administer the program. And then the fellows participated in DRA's summit in New Orleans as part of that orientation summit. Then session 2 was in Little Rock, Arkansas, with a focus on healthcare and infrastructure. That was in January. And then our third session was in March in Baton Rouge. Again, that was another first for DLI to actually have a session in Baton Rouge. Typically, we've gone we went to New Orleans for the orientation, but that was the first time that we've ever had a full session in Baton Rouge, and that was a wonderful session. And in a couple weeks, we will be in Carbondale, Illinois. Love going to Carbondale. We find that the states with a smaller footprint like Illinois, the alumni of the program stay very well connected, and you become friends for life with the people that you get to know through DLI. Session 5 this year will be an hour away from Carbondale in Cape Girardeau, Missouri. We have been to Cape at least 2 or 3 other times, but we're going back to Cape in July. And then this class will graduate in Jackson, Mississippi in September. Very excited to go back to Jackson. This will be our second visit back to Jackson. Graduation, we'll have a focus this year on infrastructure in Jackson. All right, next slide. And this is a picture of us at a Delta Leadership Network reception that was part of an orientation about, I think, 3 or 4 years ago. This picture is of the Alabama alumni in attendance. I actually went through the program. You can see me there in the back, but I graduated DLI in 2014. And but this picture is taken with the alum that were present for that DLN reception, and then Congresswoman, of course, Terry Sewell is from Selma, Alabama, and she was with us. But again, the Delta Leadership Network almost has 700 members, and we communicate via, newsletters every month. We have monthly lunch and learns for DLN members. And then every couple years, one of the coolest things that we do at DRA through the DLI and DLN is provide a professional development learning opportunity at Harvard. And so 25 to 40 DLN members have the opportunity to apply for this Harvard Leadership Executive Program and actually go to Cambridge, Massachusetts, and participate in this 4-year program that is truly life-changing. I've been a couple times. One is a participant, one is a DRA staff employee, and we're going back to Harvard. This is a Harvard year. We will be at that program November 12th through 15th of this year. And so this is for next year's cohort, the 2025 Executive Academy timeline. So applications, it's a really simple online application that'll open in June. And then the deadline will be August 16th. We will review the applications. It's very competitive. It's, again, a longstanding program. A lot of people know about it. So there's a ton of word of mouth. Typically we get anywhere from 80 to 100 applications, and we only have room for 25, 30 people. So, I always encourage people that if they didn't get in the first time to please keep applying and trying again. We will notify the applicants of their acceptance into the program in October of this year and release the full class list of the 2025 fellows sometime in November. And then next year, the orientation will take place in January. There will be 6 sessions and they will graduate in September of 2025. Next slide. Well, all right. I went through that pretty fast. Happy to take whatever questions y'all may have about DRA, DLI, or DLN.
And if you don't feel comfortable speaking, please feel free to utilize the chat box. Otherwise, you can come off of mute, raise your hand. We'd love to answer your questions.
And while we're waiting on maybe our first question, one thing, and please, ask away. I mean, I am happy to help, but one question that I get a lot is, how much is it going to cost me to go through DLI? And the answer is really nothing. I mean, this is, we really want to remove barriers to participation. And that's why if you're selected as a DLI fellow, everything is covered as part of, the DLI DLI scholarship, if you will. Your hotel, parking at a hotel if it's in a big city. We offer a very generous travel stipend. So the only out-of-pocket cost that you might experience would be like meals and travel status, but most meals are covered when you're actually, in the session. And then sometimes, if your travel stipend runs out, you might have a little bit of out-of-pocket expense. But again, really removing barriers to participation, because as y'all know, if we're really, aiming to serve those in our region, there are DLI fellows that come from very small, towns in our rural footprint, and we just want to make sure that they can participate.
I have a question. This is Derek Yeagle at Allen Parish Hospital. So what are your requirements, or what are y'all looking for when we're filling out applications and prerequisites or whatnot?
Absolutely. That's a great question. And so really the only eligibility requirement that's, pretty cut and dry is you have to live or serve individuals in the region. So, say, for example, we've had some people apply in Alabama before that live in Montgomery, Alabama, our capital, but they serve individuals and work in the counties that are part of DRA's region. So they would be eligible to apply. And in terms of what we're looking for, we just really want people that have the ability, that are in a job or a sector where the content and programming is going to make a difference, that they actually have the ability to take what they learn, what they've seen, what they've been inspired by through the program, to take it back to affect positive change. I hope that helps.
Yeah, thank you so much.
You're welcome. Other than the travel, so I'm looking at a great question in the chat. Other than the travel and meetings, are there other time commitments? And really, no. I mean, sometimes you might have to, do some reading, or, answer a survey or send us some information, but very little, other than maybe some assigned readings and that kind of thing, filling out our surveys after each session. Between sessions, there's really not a major time commitment. But just to give you an idea, of the makeup of this year's class, for example, we've got 8, which is a kind of a record number. We've got 8 small town mayors in this year's class. We have a lot of folks in economic development roles in their respective communities, local development district folks, congressional staffers, but absolutely we have folks coming from healthcare, because obviously healthcare and healthcare disparities, social determinants of health. I mean, these are things that we cover in DLI, and so would definitely encourage y'all to apply and be a part of the 2025 cohort. Let's see, will you be sending a link to where the application? Yeah, absolutely. So DRA.gov is a great source of information for all things DRA, but if you click on programs and select, Delta Leadership Institute, that would be where you would go to apply. Just DRA.gov is really all you need to remember. And then also, if y'all, would like to be in the know about everything DRA, like our grants, grant cycles, press releases, those sorts of things, there's a place on our website. I think if you the media button, and then you can sign up for DRA's news alerts and press releases. If y'all haven't already done that, that's a great way, again, to be in the know about all things DRA.
Yeah, and I just put in the chat too. I'll provide that link in a follow-up email today that I'll send with the recording and the web event as well.